Hi guys, how are you doing? And welcome back to Dr. Bailey's channel. If you're new to this channel, don't forget to subscribe, like, and share. And to my new subscribers, I welcome you all to my channel. So as I said earlier, this is Dr. Bailey's channel. So welcome on board. So in today's video, I will be talking about acronyms, okay? I'm sure a lot of you already know what acronyms are. Acronyms are like short forms of words. Acronyms are best used when you're communicating with your colleagues. And also, when it comes to diagnoses, when it comes to some plans, when it comes to some tests, some are just written in short forms. Yes, short forms are more like acronyms, okay? So you have to be able to deduce some of these acronyms, and that's why I decided today to talk about the acronyms and then just get you accustomed to most of them used at the hospitals. You might just want to grab a cup of tea because this might be a long one but highly informative, okay? All right, so let's dive into it. Okay, so I decided to arrange these acronyms alphabetically, okay, because I feel in that way it just helps everyone, it's more organized, okay? Don't expect that all acronyms will be mentioned in this video, okay? So I'm going to try my best to mention as many as possible, but definitely not all of today. So let's get started. AF, atrial fibrillation, aka above knee amputation. ABG, arterial blood gas. AMA, against medical advice. A/P, anterior posterior. BMI, body mass index. BP, blood pressure. BS, bowel sounds. BS, breath sounds. C1, C2, C3 to C7, these are the cervical vertebrae. So C1, the first cervical vertebra, C2, second cervical vertebra, and then the list goes on. CA, cardiac arrest. CC, chief complaints. CVA, cerebral vascular accidents. CSF, cerebrospinal fluid. CXR, chest x-ray. CVP, central venous pressure. CT, computerized tomography. CA, cancer or carcinoma. CHF, congestive heart failure. CRF, chronic renal failure. CT, continue. CNS, central nervous system. C/O, complaints of. COPD, chronic obstructive pulmonary disease. CPR, cardiopulmonary resuscitation. CPAP, CPAP, continuous positive airway pressure. DC, discontinue. DNR, do not resuscitate. ESR, erythrocyte sedimentation rate. ECG or EKG, electrocardiogram or electrocardiography. ED, emergency department. ER, emergency room. EEG, electroencephalography or electroencephalogram. GCS, Glasgow Coma Scale. GERD, gastroesophageal reflux disease. GIT, gastrointestinal tract. GTT, glucose tolerance test. GYN, gynecology. HB, hemoglobin. HBP, high blood pressure. HAV, hepatitis A virus. HBV, hepatitis B virus. HCV, hepatitis C virus. ICU, intensive care units. ICCU, intensive coronary care units. ICP, intracranial pressure. LOC, loss of consciousness. LFT, liver function tests. LP, lumbar puncture. LMP, last menstrual period. MCA, middle cerebral artery. MG, myasthenia gravis. MI, myocardial infarction. MRI, magnetic resonance imaging. MVA, motor vehicle accidents. NCU, neonatal care units. NICU, neonatal intensive care units. NKA, no known allergies. NST, non-stress test. OB, obstetrics. OBS, organic brain syndrome. OTC, over the counter. OR, operating room. PE, pulmonary embolism. PID, pelvic inflammatory disease. PMH, past medical history. SCI, spinal cord injury. SGA, small for gestational age. SOB, shortness of breath. TAH, total abdominal hysterectomy. TB, tuberculosis. TBI, traumatic brain injury. TFT, thyroid function tests. THR, total hip replacement. TPN, total parenteral nutrition. URI or URTI, upper respiratory infection or upper respiratory tract infection. UTI, urinary tract infection. U/O, under observation. WNL, within normal limits. X, times. Okay, so guys, that will be all for today, and I just hope you knew so many of these acronyms, because trust me, as a doctor, you can't function very well without knowing all these acronyms. You just find yourself asking people all around or your colleagues, oh sorry, what's this, can you interpret this, and all that. So I feel you should get yourself used to all these acronyms. If there are so many other acronyms that I didn't mention in this video, make your research, get yourself accustomed to acronyms. You also want to feel like the big boss, right? I just hope this video was useful and helpful. So guys, thank you so much, and don't forget to subscribe, like and share. Till another time guys, have a great day. See you, bye.